Hair fall, such a huge topic, isn't it? Everybody has hair fall. So this can be like on 2-hour video, but I'm not going to do that. Firstly, I'm going to ask you, how do you know you have excess hair fall? Which means, how do you know it's not just normal shedding of hair that can happen? Hair goes through phases of growth, isn't it? There is an anagen, wherein the hair is in a growing phase. Then there is a resting phase. Then there is a falling phase. Now, hair in its own life journey goes through all these phases. It has to grow to a certain length and it falls. Now, how long the anagen stays is very genetic. So for some people, you will see that even they don't cut their hair just doesn't seem to grow beyond a certain length. But for some people, if they don't cut, it just seems to just keep growing. So that is very genetically dependent. Yeah. So that's one thing. So there is no supplement tablet which will grow your hair if you are genetically not tuned to have it. So it's very important for you to know. Likewise, when the anagen phase finishes, for some time it rests and then it starts shedding and falling. Only if it falls will the next new hair grow. So my point is, if your hair is falling that much in excess, you should be going bald in a year, isn't it? How many of us really have that much of hair fall that you end up going bald? Which means your hair is falling and it is getting replaced. So first thing first, stop stressing. Stress in turn also will trigger your hair fall. So stop stressing. That's very, very important. Now, how do you know your hair is excess or just a normal hair fall? 50 to 100 hair strands in a day to fall is very physiological, which means to say normal. It's body's function. Like how skin kind of flakes and goes away, your doctor will tell you, right? There's a skin turnover that every month, it's a new skin for you. So it slowly comes up layer by layer, it matures and it sheds off. Likewise, hair sheds off and it is a normal physiological thing in your body. What happens when it gets alarming? Today I had a patient who came and said, oh my God, doc, I'm so scared to even comb my hair. I didn't comb my hair for 2 days and the third day when I combed, I had that much hair. But obvious, because if you don't comb your hair, you don't have to comb your hair every day. If you don't even run your hand because you're so scared, you don't comb, you don't wash, usually the loose hair will still stick there. It may not just fall off. On the third day when you're combing or you're washing your hair, all of that hair which was loose but was just stuck there will fall, and together instead of 100 plus 100 plus 100, you'll end up seeing 300 hair. And then you're all alarmed, right? So please understand, when the doctor says 50 to 100 hair is normal, it is per day. So when you are counting it at the end of 3 days, 300 hair is normal. So don't get really worried. When should you get worried is when it really is excess. You will actually see every day hair is falling. You sit, you stand, you run your hair, there is hair falling. Your ponytail, or when you tie your hair, you are realizing that the thickness of it is actually becoming less and less as you grow. So this is the time that you think, oh, there is an excessive hair fall. Or you know that you've been through a stressful period, whether it is mental stress or physical stress. Usually hair fall starts sometimes immediately after a week. In a shock it can start, or it is usually 3 months after that. Even after pregnancy, have you heard ladies or rather midwives tell you that when your baby smiles, your hair starts to fall? It's because your baby literally smiles at you after around 2 to 3 months, fixing the eye and recognizing you, right? So it's 3 months is usually the span it takes for the hair to react to that trauma that it has gone through. Childbirth is a trauma. You lose a lot of blood. It's stressful for the body. There are hormonal changes that happen. So 3 months later, you will see hair fall. Likewise, unless you have some intense shock or stress, it's usually 3 months later is when you see the hair fall. At that time, again, don't panic, because sometimes it's just a phase. Your hair will fall for another month and it will be gone. Now, another time when it is normal to have excessive hair shedding is seasonal. A lot of times when season changes, the way the blood vessels react in it, either it becomes very tight because it's winter, or it could expand really a lot because it is summer. And then the hair expands too with humidity, so hair breakage can also happen. So change of season is when you could expect a little bit of hair fall, and there'll just be a phase and that phase will pass. So these are the times when you don't panic and you just sit strong. What you could do is go to your doctor, make sure what you're thinking is right, number one, and there is no underlying hormonal issue or underlying other nutritional or health issues that you're missing out on. 2, you could also learn from her the good hair care habits, which is even if the hair is falling, please wash alternate days. Clean scalp is always good. Hair wash has never increased anybody's hair fall. So make sure that you wash your hair. A clean scalp is very important for good hair. Inflammation on the scalp leads to hair fall, which means to say, please make sure the scalp is clean, as you will feel like itching. That causes inflammation when you scratch and when you irritate the scalp. Dandruff, accumulated fat, accumulated dead cells, which is the build-up. All this can cause increase in inflammation and hair fall. So make sure the scalp health is really taken care of and hygiene is taken care of. Oiling is a great thing to do, but do not massage oil on a dirty scalp. Oiling, I will make just another video next, so let's watch that. So these are a few things you need to know, and your doctor will also put you on some set of supplements. For example, a supplement which has amino acids, certain important vitamin bits for your hair, certain minerals and certain vitamins put together really makes a great supplement for your hair growth and your hair health to get better. There's a link in the bio for you to know what is a supplement that I highly believe in and recommend. And then, like I said, inflammation leads to hair fall. So an anti-inflammatory tablet would also do a great job, such as Ra Defense, which you end up having curcumin in it, milk thistle in it, tulsi, ginger, piperine, all of these anti-inflammatory substances. So that really also helps and calms down the hair root and the inflammation. So these are a few things that really help your hair grow better. So next time when you see a little excess hair fall, please do not panic and please do not run to your doctor and just sign up for a PRP. I see a lot of people doing PRP randomly thinking that's going to help. That's not going to help. You may not even need a procedure. So please make sure you understand what is happening before you run and do a procedure. So hair shall stay on. It won't go away. Take care and keep the questions going so I can be more encouraged to do the videos.